Well, hello there, everybody. I'm Nelson Weston, and it's time for an all-new segment of Spotlight Carolina. Joining us today is our good friend from Four Seasons Hospice, Dr. Elaina Honeycutt. Dr. Honeycutt, good to have you on the show.
Thank you.
All right. Now, Doc, let's talk. What exactly is hospice? And for the sake of clarity, is hospice an actual place or location?
So many people think that hospice is a place. That's a common misperception. And while we do have an inpatient unit in Flat Rock where we manage acute symptoms, hospice is actually a philosophy of care. So hospice is for people in the terminal stages of an illness who have decided to focus on quality rather than quantity. So we help to manage symptoms, help people stay at home wherever home might be, and focus on quality so that they can have time with their loved ones.
Okay. And speaking of time, when exactly should people be calling hospice?
So hospice is usually initiated by a physician when a patient has a prognosis of 6 months or less, and when that patient has also decided that they want to focus on that quality time with friends and loved ones.
Oh, I see. That's very interesting and insightful then. So let me ask you another question then about the process itself. Does hospice, does it accelerate death? Does it make it come faster? Or?
So that's a common misperception about hospice as well. No, on hospice we are allowing a disease process to take its natural course while keeping somebody comfortable, so treating any symptoms that might come up. In fact, for some end-stage diseases such as heart failure, patients on hospice actually can live a little bit longer.
Oh, really? Okay. So how can hospice help family members and caregivers? What's that process
That's
like?
a great question. So hospice supports more than just the patient. We support caregivers and family members as well. A nurse makes visits to the home to care for a patient, but we also have music therapists and chaplain that can make home visits as well. In addition, a doctor can make a visit to the home, and we offer bereavement support as well. So it's really a philosophy of caring wholly for the patient and the family.
Like I say, this is all very insightful information. I'm curious, how many counties do y'all serve and where exactly are y'all located?
So we serve 13 counties in western North Carolina, and our main location is in Flat Rock.
Okay. Well, Dr. Honeycutt, I do want to thank you for taking the time to speak with us here today, and we also appreciate you clarifying a lot of, as you mentioned, misperceptions as well. This is all very insightful information. And for more information, you can visit fourseasonscfl.org, 828-696-6178. I'm Nelson Weston, and as always, we'll see you next time right here on Spotlight Carolina.